Ever wonder what doctors do when they go to other countries and volunteer their time and their skills? Today you're going to learn. Welcome to Talking with Docs. I'm Dr. Brad Winning.
I'm Dr. Paul Zalzal.
And today we have a guest, Dr. Noor Alolabi, who does this exact kind of thing. Welcome to our channel.
Well, thanks so much for having me on your channel.
You're a plastic surgeon, right?
Yeah, so I'm a plastic and reconstructive surgeon,
Okay.
and I do focus mainly on hand, wrist, and peripheral nerve surgery.
And the majority of your practice is cosmetic?
Unfortunately, zero.
Zero cosmetic. You're the only plastic surgeon I know who does zero cosmetic.
Yeah, very
Like an
low.
orthopedic surgeon, we don't do a lot of cosmetic.
No, well, every now and then people don't like their crooked legs.
Yeah.
But it's really not cosmetic by nature.
It's a stretch.
Okay, so you've done a bunch of this kind of stuff. Tell us about your experience with volunteerism.
Yeah, sure. So, I was always interested in global health and global surgery. The first trip that I went on I was a med student, first year med student. I went to Uganda, did some work there. And, since then, as a resident, I've been to Guatemala and yearly, I think I got to thank one of my mentors who I went with, Dr. Carolyn Levis, and she basically took me on a trip with her as a resident, and we went to Guatemala with a group called the Guatemala Healing Hands Foundation.
Interestingly, Dr. Levis and I and a whole bunch of other people went to Haiti right after the earthquake in 2010.
There we go.
Yeah,
There
no,
we go.
she's a champ for
Shout
sure.
out to Dr. Levis.
Yes,
There we go.
absolutely. Okay, so when you go there,
Yeah.
what kind of stuff do you do?
Yeah, so this group is mainly focused on sort of hand and upper extremity pathology. So we'll see, it's all for pediatrics. So we will see patients with congenital, babies born with webbed fingers, extra fingers, missing fingers. We'll see patients who have had burns as kids and then they've never been treated. So they've got all these burn contractures, and we'll see people who have had fractures that have never been treated or they've been mistreated, things like that.
Just in case anyone doesn't stay till the end, we are going to put a link at the bottom for this organization if you want to learn more about it, if you want to donate, but please stick around, there's more to come.
So, and the biggest challenge in these areas that you go is access to care?
It's access to care.
And access to care is threatened because of a shortage of care or just
It's a combination of
geography?
everything, honestly. So it's cost sometimes. It
Okay.
is access to care, just not enough specialists necessarily in certain areas. And I mean, when we go, we are essentially getting people from all over the country coming to this one spot. So there's a lot of advertisement that's happening ahead of time. There's a lot of recruitment that's going on, and bringing all these people in for essentially what is a 1 week mission, trip that we do.
Okay. And so geography is a challenge, I guess, for some people. They must travel pretty far to get to see you guys.
Absolutely.
I'd say one of the other challenges probably is the overwhelming demand. So you have to pick essentially who you have time to take care of and who you don't.
Yeah, so let me tell you a little bit about this group and kind of
What's
how
it
it
called?
works. Yeah, so it's the Guatemala Healing Hands Foundation. They've been essentially doing this for 20 years or so.
Amazing.
And we go every 18 months. I've been involved with them since 2016, and I've been on with them for 5 missions now. So they're really dedicated towards the improvement of access to healthcare in different ways. So surgery, therapy. And they also do a little bit of community involvement in one of the villages called Chicho Alto in Guatemala. And so, the types of patients that we're getting, they've really developed now a relationship with, the people there in terms of their name is really kind of known now somewhat in the country. In terms
So the people of the community plus the leaders, right? They
That's
know
right.
that you're a
That's right.
reliable
That's right.
organization
That's right.
who's sticking, you're in there for the long haul.
Absolutely. And so we're getting patients from all over. We're doing a lot of follow-ups. So we've got a great orthopedic surgeon there who is actually following up on our patients. We've got a WhatsApp group. We see pictures of our work post-op.
So they can ask you even care stuff, remotely.
Absolutely. I mean, that's the one thing that you don't want to do in a system is go help and just leave.
Right.
So we've kind of got this long-term relationship now there in terms of good follow-up. We'll see patients, we'll reoperate on them. A lot of this is pediatric, and so they'll need multiple surgeries.
So continuity of care is maintained by having someone who lives there and works there
Correct.
24/7.
Correct.
And then they kind of triage and set things up for you when you arrive.
Absolutely. So there's an element of our group and having, the founder, Lynn Bassini, who goes there as a therapist and as well will do some of the screening, and we've got people on ground there doing some of that, as well as we've got physicians who, patients will need their cast cut off, they'll need pins pulled out, things like that will all be done by them.
Okay, and equipment and technology. I mean, a lot of our surgery now is so equipment heavy and technology heavy, like everything we do has so much disposables, equipment, technology, computers, navigation, all that stuff. What's it like there? Is it set
Yes.
back a bit, or is it still at the same level?
Yeah, you know what? So we bring a lot of our equipment with us. The Touching Hands project is sort of a big contributor to this group, and essentially it is. You can check them out on the ASSH, the American Society of Surgery of the Hand. And essentially, what happens is we'll bring a lot of our equipment with us there, and obviously there's a lot of disposables and all kind of that stuff is actually present there as well. So it's a combination of both. But it's a lot of money, honestly, that goes into these trips.
Is there support from the big companies, from the surgical companies that do supply us with all our equipment? Is there some support from them?
Certainly, there has been support, and we certainly, that's a big part of it. We do appreciate the help of all these companies that do support us, because we're here working with them on a daily basis, and so they've actually contributed quite well for these trips as well, which is helpful.
And just to be clear, you're donating your time. People, the surgeons and the nurses and therapists that are going there are not being paid to go there. They're
Absolutely.
often, they might be subsidized slightly for their flights or not even.
So not even. So
Right,
this
so
is
you're paying
100% volunteer.
Yep, love
All
it.
the kids that receive their treatment, this is completely free. So
Love
we will
it.
pay for their surgery, for their accommodation at the center while we're operating, and everything basically is paid out of pocket for the volunteers.
Okay, and so then let's talk about that, where the money comes from. Where are you getting the money to do this stuff?
Pretty much 100% of this is donations.
Okay,
So it's a lot of people like you, watching videos like this who read about this group, or they like something about it, they go and they donate. It's usually the volunteers who are going will kind of do a fundraiser right before our trip, and again, mainly donation.
generate some money. So there's some way you can make a difference if you do. Talking with Docs has supported Dr. Alolabi in the past, and we plan to in the future. So please, if you can, it would be appreciated.
Got to ask, what's the reaction of these families when they see their child or the child with their own hand, and see the differences that you make?
Yeah, honestly, it's one of those things where sometimes you go there, you can't speak the language, but you don't need language for this. I mean, it's just the look on the faces of these mothers and fathers and kids, it tells you everything, all you need to know. This is why, we went into medicine.
Yep.
At the end of the day, it's a big privilege that we have working as a plastic surgeon, as an orthopedic surgeon. And when you go and do these types of missions, it really makes you think of why you actually did it.
And appreciate it, right? Like,
Absolutely.
I'm putting you on the spot.
Absolutely.
The one case that you always think about, or is there one case that sort of rings home for you?
Yeah, so there's a girl named Eva that I've been seeing since my first trip.
Oh, wow.
And,
Since 17.
Yeah, and I've done 4 surgeries on her now.
Wow. Did
Basically,
you get it right in the end? I'm just kidding.
Yeah.
Yeah, okay.
Trying.
Yeah, okay.
So she was born basically with radial club, or basically she was born with no thumb.
Okay.
And essentially no radius as well.
Okay.
And so, I moved her index finger, made it a thumb on one side, and then we did that on the other side. And then we've just been sort of, again, making it a bit better every time. So
Okay. Wow, and that's the case that just rings home for you.
yeah, it's one of those cases as a resident doing, with one of your big mentors at the time, and starting that off, and then, you see the patient coming back every time, and they start recognizing you.
Well, you
Initially,
develop
she
a
was a year and a
relationship.
half, and now she's 8.
Wow.
So
And
Incredible.
I think that's what the average viewer may not even recognize, that you can lose a finger. If you lose like your third finger or your fourth finger, you're able to, but your index, in particular your thumb, like that, it is so critical for so many activities that person's entire life has changed
Absolutely.
because of this.
Absolutely.
Opportunities educationally, vocationally.
the thumb is 40% of your hand function.
There you go.
So not having a thumb is obviously a very big deal. You can't just function like this, and so
Amazing.
Yeah, especially if you don't have a car.
that's right.
Well, and what about safety? Do you always feel safe there, or at any time where you feel like, oh boy, this is getting a bit dangerous?
Yeah,
here for
so
me?
the other thing is we do have a local team there that basically will take us everywhere, and they've got buses and vans, and so we're always with them, regardless whether we're going to a restaurant to eat or whether we're going to the hospital, whether we're always with this team that takes us around. We're always felt safe, and honestly, I've never ever felt unsafe in this environment. Yep.
Well, personally, I'll say thanks for all that you and that group does. It's amazing, like all the organizations that do that great work, for sure.
It is incredible. The most volunteer work I've done in the last year is make my bed.
You got 4 kids, man. Don't say that.
But we do appreciate it, and we will continue to support you, and we really hope some of our viewers will support you as well.
Thanks very much.
You're very welcome. And if you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health. So you don't do any cosmetic. So you're not going to
Very
Guatemala
low.
and doing facelifts
Not
and
really, not
rhinoplasties?
really. Maybe next on my list, but
Okay.
not yet.
We'll see you next time.
Thank you.